Hello everyone, hope you're all doing very good. Okay, now we are going to see about fetal skull. Okay, what is the importance of fetal skull? What are the various landmarks? What are sutures? What are fontanelles? And what are the various diameters of fetal skull? And also, what are the swellings that you can find on the fetal skull as the baby is born? Okay, now we'll start. Fetal skull. Now, fetal skull is the most important part in the fetus. It is the largest and least compressible part. Why I say it as the most important part? Because as the head is born, okay, as the head of the fetus is born, there is rarely any difficulty in the delivery of the breast of the fetus. Okay. Now, this is a fetal skull. Okay. Basically, we divide the fetal skull into two regions. Okay. One is the base. Okay. So, this is the base region and another one is the vault region. Okay. So, fetal skull can be seen in two parts. Number one is the base region. Number two is the vault region. Okay. Now, base if you take, this is more ossified part, very least compressible part. Okay. The whole of the bones of the fetal skull are not ossified. Okay. But comparing to the vault, this base is more ossified. Okay. And regarding vault, they are less ossified part and have various landmarks, sutures and fontanelles. Okay. Now we will see how the vault is divided. Okay. Basically, vault is divided into sinciput, vertex and occiput. Okay. Now, what is sinciput? Sinciput extends from Now, what is sinciput? Sinciput extends from the glabella to the anterior fontanelle. Okay. Now, what is vertex? Vertex extends from the anterior fontanelle to the posterior fontanelle. Next, what is the occiput? It extends from the posterior fontanelle and downwards and backwards. Okay. So, if you see this picture, you will be able to understand. Okay. So, basically, this is the hole of the vault, right? So, this is the hole of the vault, but remember, the whole area is not going to be called as vertex. The anterior part will be called as sinciput, okay, that is from the glabella. So, this region is the glabella, okay. Can you see the glabella? Okay, so this region is the glabella. From the glabella till the anterior fontanelle, it is the sinciput, and then from the anterior fontanelle, okay, and then from the anterior fontanelle till the posterior fontanelle only, it is the vertex, and downwards from the posterior fontanelle, it will be the occiput. Okay. Now again, we have one prominent in the occiput. So this prominent region is known as occipital protuberance. Okay, and that is lying below the occiput is known as suboccipital region. Okay. Now if we see the bones of the fetal skull, we have two frontal bones, two parietal bones, two temporal bones and one occiput. Understood? These are the bones. Okay, you are able to see frontal bone, parietal bone, temporal bone and the occiput. Now what is glabella and what is nasion? Okay, so glabella is a prominence seen between the supraorbitary or supraciliary ridges, okay, whereas nasion is the root of the nose. Okay, I hope there is no confusion in these two terms. Okay, so if you see, this is the glabella. Okay, so basically if we draw a diagram, so these are the supraorbital ridges and imagine this is the nose. Okay, so this region that is present between the supraorbital ridges is the glabella, and this region that is the root of the nose is the nasion. Understood? Okay, so this is the glabella and this is the nasion. Okay, now we will see what are the various sutures of the, now we will see what are the various sutures of the fetal skull. Sutures of the fetal skull include, number one is the sagittal suture. Now sagittal suture runs from anterior to posterior. Okay, it runs basically from anterior to posterior. Okay, and it divides the fetal skull into right and left half. Okay, next one is the coronal suture. Remember, coronal suture is a transverse suture. Okay, and this is going to be present between the frontal and the parietal bones. Okay. Third suture is the lambdoid suture. This is also a transversely running suture, and this is present between the parietal and the occipital bones. Understood? And also we have the frontal suture, which is also called as metopic suture. Okay, so from the name itself you would have identified that this is present between the two frontal bones. Understood? Now in this pic we are able to see the various sutures. Okay, see, we have the coronal suture, sagittal suture, lambdoid suture. Okay, so what is sagittal suture? Sagittal suture is an antero-posteriorly running suture like this. Okay, now where we find the coronal suture? Between the frontal and the parietal bones lies the coronal suture, that is a transversely running suture. And then the lambdoid suture is present between the parietal bone and the occipital bones, and this is also a transversely running suture. Understood? Okay. Now frontal suture is going to be present between the two frontal bones. Okay, frontal suture is going to be present between the two frontal bones. Next one. We will see the various fontanelles now. What are fontanelles? Fontanelles are membrane bound spaces. Okay, so rest of the vault at least it will get less ossified, but these fontanelles are going to be light only by the membranes. Okay, and they are formed by intersection of the various sutures. Okay, so at birth, if you see, an infant will have 6 fontanelles. Okay, and among this include, we have one anterior fontanelle, one posterior fontanelle, two temporal fontanelles, and two mastoid fontanelles. Okay, so total if you take, it will come 6 fontanelles. Okay, and we are going to discuss about the most important fontanelles now, that is the anterior fontanelle and the posterior fontanelle. If we take the anterior fontanelle, this is formed by the intersection of sagittal and coronal sutures. This is a diamond shaped fontanelle and it is the largest of all the fontanelles. It measures around 3 cross 2 centimeters, and this usually ossifies around 18 months after birth. Okay. Coming to the posterior fontanelle. Posterior fontanelle is formed by the intersection of the sagittal and the lambdoid sutures, and this ossifies around 6 to 8 weeks after birth. Anterior fontanelle is also known as bregma. Posterior fontanelle is also known as lambda. Now, what is the importance of these fontanelles? Okay. Now, we will see what are the importance of these fontanelles. Number 1. Now, we will see what are the importance about this fontanelles. Fontanelles help in assessment of the fetal head position during labor. Okay, so basically during labor we will be doing a pervaginal examination, and you will be trying to palpate the sutures as well as the fontanelles. Okay, we know the anterior fontanelle is the largest fontanelle and you can palpate it easily while doing a pervaginal examination. So whichever side the anterior fontanelle is present, that is considered to be the anterior aspect of the fetal head, right? Then also after birth, also during fetal development, as well as in early stages of the development of child, this helps in accommodation of the brain growth. Okay, and during infancy, if this fontanelle is seen swollen, then you have to suspect any increased content in the cavity of the skull, maybe a hydrocephalus, and if it is depressed, okay, then there can be chances of dehydration in the infant. Understood? Okay. Now we will pass to the various diameters of the fetal skull. Diameters of the fetal skull include, first we will see the transverse diameters, including biparietal diameter, bitemporal diameter and bimastoid diameter. You can remember these diameters with the mnemonic PTM. Okay, and the measurement of these diameters are also easy. Okay, So, it is 9.5 centimeter, 8.5 centimeter and 7.5 centimeter. Start with 9.5 centimeter and reduce 1 centimeter for the temporal and another 1 centimeter for the mastoid. Okay. So, from the name itself you would have got. So, these are the diameters that is present between the biparietal, means present between the two parietal bones. Yes. What is bitemporal diameter? That is present between the two temporal bones. Yes, very good. And we also have the bimastoid diameter present between the two mastoid bones. Now we will see the other diameters. Occipito-frontal diameter. This measures around 10 centimeters and from the name itself you would have understood. It is seen between the, repeat. From the name itself you would have understood, it is seen between the occipital protuberance and the frontal bone. Next is mento-vertical diameter. This measures around 13 centimeters, present between the mentum or chin and the vertex. Okay. In the vertex, we usually take bregma as the landmark point. Okay. Then other diameters include suboccipito-frontal. Okay. So, from the suboccipital region to the frontal bone. Okay. And this measures around. Now we will see the biparietal and bitemporal diameters. Okay. So, this is how it is. Okay. So, it extends between the two parietal eminences. Okay. And this is the bitemporal diameter. So, this is basically 9.5 centimeters and this is 8.5 centimeters and bimastoid diameter is the 7.5 and bimastoid diameter is 7.5 centimeters. Okay. So, which is the largest transverse diameter? Is the biparietal diameter. Which is the smallest transverse diameter? Is the bimastoid diameter. Okay. Now, we will see the other diameters also. Next diameter is we will see the other diameters also. This occipito-frontal diameter. This measures around 11 centimeters and it extends from the occipital protuberance to the glabella. Okay. Next diameter is mento-vertical diameter. So, mentum means it is the chin. Okay. So, this measures around 13.5 centimeters and it extends from the mentum or chin to the highest point on the vertex. Okay. Next diameter is suboccipito-frontal diameter. This measures around 10 centimeter and it extends, okay, from the nape of the neck to the highest point in the frontal bone. Okay. Next is suboccipito-bregmatic. This measures around 9.5 centimeters and it extends from the nape of the neck to the bregma. Next diameter is submento-bregmatic diameter. This measures around 9.5 centimeters again and it extends from the submentum region. Okay. Otherwise, it is the junction between chin and floor of the mouth to the bregma. Yes, we have one more diameter, that is supra-subparietal diameter. This measures around 8.5 centimeters and it extends from the highest point of one side of the parietal bone to the lowest point of the other side of the parietal bone. Okay. So, these are the various diameters of the fetal skull. Okay. So, in this picture, okay, if you see this picture, you are able to see the occipito-frontal diameter. Okay. This is the vertico-mental diameter. This is the suboccipit, starting from the suboccipital region or the nape of the neck. Suboccipito-bregmatic diameter and this is the submento-bregmatic diameter. Okay. Now, among these diameters, which is the greatest diameter? It is the mento-vertical diameter. Okay. Now, we will try to find out these diameters. Okay. We will try to find the various diameters in this picture now. Okay. First, what we have to do is we have to identify the various landmarks of the fetal skull. Then it will be easy for us to identify the diameters as well. Okay. So, this is the chin. This is the submental region. This is the suboccipital region. This is the occipital region. This is the vertex, coming in the site of vertex. This is the bregma and here we have the glabella and this is the frontal bone, right. Now, identifying the diameters will be very easy for you. Okay. So, now one by one. Okay. So, what is the first diameter? It extends from submental region to the bregma. So, it is a submento-bregmatic diameter. Okay. Second one, it extends from the chin or the mentum to the vertex. So, it is the mento-vertical diameter. Third one, it is extending between the occiput and the clavula and it's a straight line. So, it is a occipito-frontal diameter. Fourth one, extending from the suboccipital region to the bregma. So, it is suboccipito-bregmatic diameter. Fifth one is extending from the suboccipital region to the frontal bone. So, it is suboccipito-frontal diameter. Sixth one is extending from the submentum region to the vertex. So, it is submento-vertical diameter. Okay. So, whenever they ask you to find some diameters like this, first try to identify the landmarks of the fetal skull, then it will be easy for you. Okay. Yes. Now, suprasubparietal diameter. Okay. So, this is the suprasubparietal diameter. So, it basically extends from, this is the parietal bone, right? This is the parietal bone. So, from lowest end of one parietal prominence to highest end or the other side bones parietal prominence. Okay. So, that one you have to know, and it measures around 8.5 centimeters, right? Now, what is the importance of these various diameters? Okay. So, these various diameters help in deciding the position of the fetal head, okay, and the presenting part. Okay. So, for example, when a fetal head is said to be in flexion, okay, there can be three types of flexion. Either it can be a complete flexion, or it can be a incomplete flexion, or it can be a deflection, means a straight attitude. Okay, so the head can be deflexed. In these three categories, what are the various diameters will be presenting means it is in the deflexed head. Okay, remember, we'll start from here. It is the occipito-frontal diameter. Okay, and in incomplete flexion, it is the suboccipito-frontal diameter. Okay, and in complete flexion, it will be the suboccipito-bregmatic diameter. Okay, and coming to extension, okay, suppose if the fetal head in extension, then it can also be in three types. Okay, one is partial extension. Okay, another one is incomplete extension, and another one is complete extension. Okay. So, what are the various diameters presenting in these three extension means? It is the mento-vertical diameter, and in incomplete extension, it is the submento-vertical diameter, and in complete extension, it is the submento-bregmatic diameter. Okay. Now, if you see in flexion, it is the vertex that is presenting. Okay. And the attitude of this occipito-frontal diameter out of deflexed head is also known as military attitude, because it will be having a straight position like this. Okay. No flexion or extension. And in extension, when the mento-vertical diameter is presenting, the baby will have a brow presentation, and when the submento-vertical diameter or submento-bregmo diameter presents, it is a face presentation. Understood? And also remember, when the largest transverse diameter of the fetal head passes to the brim of the pelvis, then only we can say that the engagement of the fetal head is occurred. Okay, so like this. Okay, when the largest transverse diameter of the fetal skull has passed through the brim of the pelvis, then engagement is said to be occurred. Okay, see, for in this example, in this picture, we are able to see that this fetal head has crossed the brim of the pelvis and has descended down to this level. That means the fetal head is said to be engaged. Suppose if it is descending in this region only, okay, if it hasn't crossed the brim of the pelvis, this is the brim of the pelvis, right? So, if it doesn't cross the brim of the pelvis, then the fetal head is said to be in a floating position, okay. I hope you are all clear with what are the various diameters, measurements, what is engagement and what are the various presentations also, okay. Now, we will see something about molding. See, as the fetal head is descending through the pelvis, there should be some adjustments between the fetal skull bones, the sutures, etc. to make the least possible diameter of the fetal skull. Okay. So, this is facilitated by a mechanism called molding. So, these are the various grades of molding. Okay. So, 0 plus molding means literally you are able to see the suture space. Okay. And 1 plus molding means the bones are coming and opposing each other. Okay. And in 2 plus molding, what is happening is there is overlapping of the fetal skull bones, but if you give some pressure, they will separate easily. And in grade 3 molding, what is happening is this overlapping is more significant that even with the pressure, the bones won't separate. Understood? Okay. Now, there can occur various swellings over the fetal skull as the baby is getting delivered, okay, and they are important in the post-delivery management of the baby, okay. So, we will see one by one. Number 1, it can be a caput succedaneum, okay. So, what is caput succedaneum is, it is a diffuse swelling present over the fetal skull. Basically, this is a soft tissue edema and it crosses the sutures of the skull. It will be present at birth and it will go away in few hours. Okay, this is present usually at birth and disappears after 12 to 36 hours. Okay. Next one is cephalhematoma. Cephalhematoma can also occur during normal vaginal delivery. This is basically a subperiosteal swelling. It is limited by the sutures. This is not present at birth. It develops only after few hours of birth, okay, and takes few weeks or months to regress, okay. So, these are the pictures to understand. This is a caput succedaneum. This is a cephalhematoma. Okay. What is happening in caput succedaneum is the swelling is present throughout the fetal skull. Okay. So, it is crossing the sutures also. But in cephalhematoma, it is limited to one sutural line. Okay. Also, we can have two more swellings in the fetal skull at birth. So, one can be subgaleal hematoma, where the bleeding is formed between the periosteum layer and the galeal aponeurosis of the fetal skull. Okay. This subgaleal hematoma is a boggy swelling that is occurring after 12 to 72 hours of birth, and it can result in hyperbilirubinemia or hemorrhagic shock. So, mostly this is managed by fluid resuscitation, and remember, subgaleal hematoma is also limited by sutures. Okay. Next is encephalocele or meningocele. Meningocele, only the meninges are present. Encephalocele, when brain tissue also herniates. Okay, so this is mostly present over a sutural line, and this can become tense as the baby cries. Okay, it is a severe congenital abnormality. Okay. We are done with this video. Until we meet in the next video, take care, happy learning, and bye bye.